I'm Dr. Roshni. I'm originally from Johor and I'm working as a medical officer in Hospital Kuala Lumpur in the dermatology department, and I have Crohn's disease. I've been diagnosed with Crohn's disease since the age of 25 years old, and I'm currently on infliximab biologics since I'm 27. I'm currently 31 years old, and I'm married. I have no children yet. I was diagnosed with Crohn's disease when I was in medical school. At that time, I had loss of appetite, loss of weight. I constantly had diarrhea more than 20 times per day. And it took some time for diagnosis to happen because I did not really seek treatment immediately. I thought it was just IBS or something. And then eventually I did seek treatment, and therefore I was diagnosed with Crohn's disease. At that time also I had perianal fistulas requiring surgeries, and subsequently after commencing on infliximab, my Crohn's disease were pretty stable. Okay, so everyone feels that having this disease it's quite stressful because it's a chronic relapsing disease and there's no cure available. I feel that having Crohn's disease actually helped me become a much stronger person, I believe. Like any other ordinary person, they would just work, have a family, and have a normal life. But with this disease, to me, I started venturing into sports. Like I'm active in a martial art called Brazilian Jiu-Jitsu, and I compete in national level. I'm now a blue belt in this sport, and I'm also trying mixed martial arts as well. So I feel that with this disease, it actually helped me to live a healthy lifestyle, and it helped me face life a bit better. Living with IBD, I believe that with biologics, of course, it will help me to have a good quality of life, and with also good diet and lifestyle measures. Okay, in terms of, I think, I definitely hope there will be a cure for this disease, of course. I hope there's a lot more research projects being carried out in Malaysia to help find cure for this disease. And I also hope that the biologics are much more cheaper and made available for everyone. And I hope that the ministry take note on the increase of prevalence and incidence of this inflammatory bowel disease in Malaysia, and they can do something about it and help those who need it most.
Hello, hi everyone. My name is Kobu, son of Tirumanathan. I am 39 years old this year. I've been having Crohn since 2013, being diagnosed in Sumatera symptom. Currently, I am following up in Pusat Perubatan Universiti Melayu under Prof. Ida, Gastro team, and also under Prof. April, surgical side. I have actually gone for 3 laparotomy, and currently I am on stoma bag due to my recent surgery in 2016 after the reversal of stoma, which requires me to wear stoma bag due to the intracutaneous fistula. I am on azathioprine currently, 2 tablets a day, and due to the surgical removal of intestine about 1 meter plus, I do have to take vitamins via injection, such as vitamin B12 due to deficiency of B12 vitamin, which was found out due to my recent admission, whereby my HbA dropped to 4.5 and I've been diagnosed with encyclopedia. At the same time, I'm also working as a pharmacist in the Ministry of Health, and I do have support from the working side, whereby my bosses at the same time my working colleagues do understand my situation and gives full support in that sense. Since I am very constantly back, I do have issues in my daily activities, including managing my children, doing household activities whereby it requires me to plan. I will have issues with my posting back. At the same time, we do have IBD support group, and I share my experience with other friends, patients who has similar issues like mine. We exchange our experience on how to manage the including colostomy bag issues, so taking medicine or what are the diets that we can take in order to curb these fistula issues. At the same time, I do have support from the family. My wife understands the situation, so there are days where I need to rest fully due to my flight condition. She understands totally the situation.
Hi, my name is Anis. I'm 54 years old and I've had Crohn's for 10 years. I started off on the clinical trials for vedolizumab, or however you pronounce it, and then went on to azathioprine, which I had an adverse reaction to, and now I'm on captopril and allopurinol. First 5 years, I would say, was probably the hardest. It was a struggle. It was a fight to be normal. It was a fight to get better. Since then, I think things have stabilized and I'm better anyway. I think the one thing that I would like to stress, other than this disease really sucks, is that having the support of your doctors, family, friends is really important, but also to find others who have gone through this disease has been really important. It's hard to explain to other people who haven't had Crohn's disease what it's like. Sometimes you just need somebody to understand what you're going through, and while your friends and family sympathize, they don't actually empathize. And it's also good to have people who have had this for longer or had different experiences, so that when you have questions about medication, about food, about how not to kill somebody because of it, there are people who understand and can tell you what they've gone through, and maybe you don't think you're weird. Other than that, I've been more or less stable for the last 2 years. You do have normal. I think that the hardest part is just trying to cope with pain, the diarrhea, the fatigue, and people not understanding that this is a disease. And probably the worst thing you can say to any one of us is that you don't look sick. I don't know what else to say. Thank you.
Hi, my name is Saran Nagapan. I am 29 years old. I'm a senior auditor working in Prison Unit. I'm a Crohn's patient. At 2008, I had my first symptoms with a fistula, but was diagnosed that I have Crohn's in 2012. And that 4 years of times, I went for a few times of surgery. And at last, in 2012, August, I was diagnosed that I have Crohn's. And since then, I take drugs, infliximab, for my Crohn's. And since 2012 until now, I can recover very fast and still ongoing for the treatment, and my disease is under control. And that's my background. And my meditation is, as I told you, that I took infliximab and azathioprine. Since 2012, I take biological drugs, and I'm taking together with the azathioprines. And till today, I am under the same drugs, and it's coped with me. But it's under the monitor. The doctor always wants me to monitor me. Is my disease is active or not? At the same time, I need to go for endoscopy every year to make sure that my Crohn's is under the control and not active. As I told you, I'm working as a senior auditor. I have undergone few problems in my workplace since I'm joining work 3 years ago. When you're attending a meeting with your clients or with your board managers, and you need to go to toilets. Especially me, I'm an ostomate as well, and I need to make sure my ostomate in the good condition before I attend any meetings. That's an issue where I have leakage sometimes, but I need to. But now I learn to manage very well. As a part of the support, I have a good support from my family and friends, my doctors, especially Prof. Shanti, Prof. Ida, Prof. Raja, and many gastros from SUKM and UMMC. They were very good doctors, and they keep updating, they give a good information, and I just follow their advice. If in case I need any moral support, I meet up with my friends or any other patient that have Crohn's, I talk to them, and we're having a sharing. And for your information, we have Crohn's support groups, which we meet up together. We discuss what's the current issues for every patient and what's the conditions, and we try to give a motivation and any other support to them to make sure they can manage their Crohn's very well.
Hi, my name is Eileen, and I'm currently 26. I am from Kuala Lumpur, and I just finished my medical degree, currently waiting for my husbandship. I've been diagnosed with Crohn's disease when I was 18, so that makes around 8 years ago, and I've been on infliximab for the past 5 to 6 years. I remember when I was 18, I started having a bit of symptoms. I had abdominal pain, I remember feeling nauseated, and I also remember having diarrhea. And I was always feeling below par. So my dad brought me to the doctor, and which I did an OGTS, a scope, and they diagnosed me to have GERD, gastroesophageal reflux. I took pantoprazole medication for roughly 6 months, and it did not quite work for me. I was still feeling very unwell, and one day I remember I couldn't lift my right leg up, and that's when I went back to the doctor, and after a physical examination he told me that I have appendicitis. So that night itself, I went into the operation theatre and had my appendix removed. After the surgery, it was the start of my nightmare. I remember having excruciating pain every night. I would cry myself to sleep, I would wake up crying because it was so painful. I would rush to the toilet, and when I was readmitted, the doctor did a colonoscopy and told me that I have Crohn's disease. That's how I was diagnosed. And I was started on steroids and Celofop, which is sulfasalazine, for which it didn't quite work for me. I was on it for almost another half a year. It didn't work. I was constantly lying on the bed. I couldn't leave the house. My mom would cry every night. My dad started doing grocery shopping just to buy me food and all that. But I just didn't have the appetite to eat. Every day I would just eat maybe 1 or 2 spoons of rice, and then I'd go back to sleep. But I took a lot of Ensure, the milk. That's how I gained my nutrition and all that. Yeah, and then I was introduced to Crohn by one of my church members who was also a Pete's Gastro in UM. I remember the first time I see her, and I knew I was in very capable hands. Yeah, and I started on infliximab after the first appointment as well. I do have my daily struggles. Once a while, I still have these abdominal symptoms. I still have pain over my right iliac fossa. I still have nausea. I wake up almost every morning with nausea, and once a while, I still have to rush to the toilet. I still have diarrhea. But I guess this is my new normal, and I learned to live with it, and I learned to handle all these things. I think exercise really made a huge impact in my life, and it really made a huge difference. I started with jogging. I started jogging around the house and all that, and when my weight wasn't increasing a lot, so I started working out. I went to the gym and I started lifting weights. And I really see a huge difference, and my symptoms have significantly improved ever since I am more active. And also in terms of diet, I try to take up my diet, but it's difficult. Sometimes I eat a ton of ice cream and I'm fine, but sometimes when I eat just salad and I'm not okay. So it really is a balance, and you really have it's something like trial and error. Sometimes you take this, you're fine, and sometimes you take that, you're not okay. I was hoping that in the future maybe biologics can come in the form of oral medication, so that I don't have to waste my time sitting down there to receive the infusion. I can just take the pills and go back to my normal routine, and that would be really good. And of course, a cure. I really hope for a cure.
Hi, I'm Yavinesh. I'm a Crohn's patient. I'm 37 years old, and I've been having this Crohn's disease since year 2004. But it took about 1 year to actually diagnose the disease through colonoscopy, which I did in PPUM. The medication that initially I was taking, like pentasa and sulfasalazine, together with azathioprine, and currently I'm on infliximab with azathioprine, and my complication is getting better, but under control. But I still do have a stricture, which is still in a manageable condition. In terms of my situation in workplace, is still can be said manageable, as long as I've been seeing my doctor frequently and without missing any appointments. And I've been following whatever medication is suggested by doctors, and without fail, right? So before the sickness actually diagnosed, I've been having problems going to work. Okay, I have to take medical leave because I feel like very tired, and the urgency to the toilet and all that. But now everything is under control. Besides that, I get a good support from my family members. Okay, now I'm having 2 kids. Okay, thank you very much.